Falls and fall prevention has become a global concern. In the United States, it is now known that every second of the day, an older person falls. And every 20 minutes of the day, an older person dies because of the fall. The good news is there are lots of organizations, not only in the United States, that have done research on fall prevention and have shared their knowledge on how to do it. It takes a team to deal with falls and fall prevention. We get ourselves acquainted with the patient, analyze their home situation, their fall risk, and provide the training that they need. We provide exercises for strengthening the legs, improving balance, and training in ambulation. After all, exercise is the best medicine. It is the best medicine for fall prevention.
There are a lot of simple strategies that we teach within our fall prevention program, but there are several that you can get started with today. You really want to avoid clutter. You want to create wide passageways to walk. Tie back loose cords and wires and pick up any throw rugs, because people often slip or trip on these items as well. Pace yourself when doing work around your home. Research shows that by actually pacing yourself and taking frequent rest breaks, you'll get more accomplished. But even more important, you'll reduce your risk of falling because you won't be fatigued. In the bedroom, we suggest that you get dressed in a seated position. It's far easier to thread your feet through your pant legs or button your shirt while you're seated than standing. We also recommend the use of a bedside commode or a urinal to avoid frequent trips to the bathroom in the middle of the night, or if you have difficulties with mobility. In the kitchen, we suggest organizing your most frequently used items at eye level to avoid having to step up onto a stool or a chair or to squat down too low to reach for something in a low cabinet. We also have simple tools such as a reacher to use if you drop something on the floor. The bathroom is one of the highest risk areas where people have a tendency to fall and have serious injuries. You really need to avoid holding onto the towel rack, the soap dish, the shower curtain rod, or doorknobs, as these items are not strong enough to sustain your weight. In addition, people tend to slip when in the bathtub as well. We recommend using a tub transfer bench, a shower chair, grab bars, and a handheld shower to avoid slips within your tub and bathroom. We also recommend the use of non-slip stickers in your bathtub, as well as the use of a non-skid bath mat, so that when you step out, you won't slip on the mat and your feet can be dried. When possible, we suggest using a chair in the bathroom. This way you can sit down and dry yourself off, as well as use it to assist you when getting dressed. We recommend the use of a raised toilet seat and commode. Very often the toilet is too low, which increases your risk of falling when trying to get up. All patients that come to our fall prevention program will have a visual screen. We know that patients that have visual deficits are at a higher risk for falling and also have a more difficult time engaging in their environment. If you have poor vision, you must ensure your house is well lit. We also recommend the use of night lights on the pathways to your bathroom and in your bathroom. Ensure they have automatic sensors so you don't have to worry about turning them on. When possible, we would also install additional light switches. An example may be installing a light switch at both the top and the bottom of a tall staircase. When stepping outside or coming inside, you must pause and allow time for your eyes to adjust to the light before you begin walking. If you wear multifocal glasses, you're at a higher risk for falling, as many patients have a difficult time with depth perception. Take your time when stepping on and off stairs or walking on uneven surfaces. If you wear eyeglasses, make sure your prescription is always updated. We also recommend you keep your eyeglasses by your bedside so as to have them available the following day when you get up. We recommend patients see their eye doctor a minimum of every 2 years.
When walking outside of your house, if you have stairs, please remember to hold on to the rail. And for extra support, use a cane. The bilateral support will help you when going up and down the stairs. Remember, good leg goes up, the affected or bad leg goes down. Please don't look down with your entire body. You can glance with your eyes. If you should happen to fall, please remember these 3 positions: to crouch or tuck, twist, and roll. Do not put your arms out in front of you. Do not stiffen up. Your goal is to try to get up as safe as possible. So try to cross your right leg over your left or your left leg over your right. Brace your arms and twist your body up, and then try to walk your feet into your hands or your hands into your feet, and walk your arms up your legs to stand up into the erect position. As you're laying down on the floor, we want you to roll to your strongest side. Push off of your elbow and then get to all fours. Get a sturdy chair. Put your arms on the sturdy chair and then walk your body up to get your feet planted on the ground. And then you can put your hands on the armrests or the back of the chair to get up to the erect position.
Today we're going to be discussing the effect of medications on falls. Unfortunately, a lot of people are on multiple medications for necessary reasons, and these medications will make us vulnerable to fall. The first thing I advise you to do is make a very comprehensive list of all the medications you are taking. Make sure you ask your doctor about your medications and ask them 3 questions. Do I really need to take this medication? What will happen if I do not take this medication? Is there another dose, a lower dose that you can give me, or another medication, an alternative medication that will not cause these side effects?
New York City Health and Hospitals is very concerned about your family and your safety. We really recognize how devastating a fall could be and how much it could impact the quality of your life. We also recognize how important prevention is, and we really want you to feel comfortable to talk with your physician about your risks of falling and any of your concerns. Please also ask for a referral to our rehabilitation departments, where our expert physical, occupational therapists, and rehabilitation physicians can help you.